we're headed off to India to see if this claim that this herb that's commonly used in Indian traditional medicine or Ayurvedic medicine can actually deliver on its promise of improving vigor, decreasing fatigue, enhancing muscle strength and endurance, and improving overall health. Hi friends, welcome back. I'm Dr. Chan. In today's video, we're going to take a deep dive into looking at this herb called ASHWAGANDHA. Patients often ask me who have low testosterone, is there any natural way of increasing testosterone levels that doesn't involve injecting themselves with needles or taking synthetic testosterone? A lot of people have been telling me to look at ashwagandha, also known as Indian ginseng, as a possible way to do these things. So in this video, I'm going to share with you a recent study that I came across from Australia that explores this question, and I'm going to share with you two of the most interesting results that came from it. It looked at overweight men aged 40 to 70 who had fatigue, so they were randomized either to receiving placebo, which is basically something totally useless, or 600 milligrams of ashwagandha. And they did this for about 8 weeks. They did a whole host of measures looking at scores of people's psychological well-being, sexual well-being, and then also measured their hormone levels with like testosterone and DHEAS, which are both the male sex hormones. They also looked at cortisol levels, which is associated with stress. What they found that was the most interesting was that the people who received the ashwagandha actually had a 18% increase in their DHEAS compared to those who received placebo. And then the ones who were receiving the ashwagandha also had a 14.7% increase in testosterone levels. Now, they didn't see any improvement in fatigue or sexual or psychological well-being. Now let's talk about side effects. One of the things that we always worry about with testosterone supplementation is that patients with cardiovascular disease risk, namely people who've had a heart attack or a stroke in the past, are at increased risk of having side effects from being on testosterone. Same with patients who have a diagnosis of prostatic disease, specifically prostate cancer. You do not want to give synthetic testosterone to these two patients classes, as it might cause the prostate cancer to grow faster and it might cause an increased risk of heart attack or stroke. Now, the good thing about the ashwagandha is that during this study, at least, there was no side effects that were reported. Now, a normal level of testosterone in a male is somewhere in between 300 to 1,000. And it's one of those things that fluctuates throughout the day. As the day goes on, the testosterone levels drop so that they're the highest in the morning. And then while people are sleeping, it starts to replenish. So somebody with diagnosed low testosterone of 300, if they were to go on ashwagandha, based on this study, you would see about a 15% increase in your testosterone level. So it would bump it up from 300 to about 345. Now, some of the other ways that you can also increase your testosterone is to decrease the amount of body fat that you have. In your body, the fat converts your testosterone that you have floating around into estradiol or estrogen, where it's not able to be used as testosterone. Other things are to stay away from certain foods that are pro-estrogenic, like soy products, for instance. And then finally, exercise. All these things are just natural ways of increasing your testosterone level that don't involve having to stick a needle in your muscle. Well, thanks so much for watching. If you have any questions, please leave them down in the comment section below. Now, if you've ever tried ashwagandha and you have some anecdotal results, I'd love for you to share them down in the comment section below. All right, have a great day, guys.